Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, Jonah Club listeners. Today's paper is about the gentle wave system. As we know, it was developed in the mid 2010 by Sun Indo. It is a multisonic irrigation technology designed to improve the root canal disinfection, combines negative pressure, acoustic energy, and fluid dynamics to create the hydrodynamic cavitations that will eventually increase the irrigant penetration, removal of tissue debris and biofilm from complex anatomy inaccessible areas such as isthmuses, bladder canals, reduces the need for extensive instrumentation and minimize apical extrusion of irrigants. Most of the available evidence comes from in vitro studies. A recent review showed that 80% of the laboratory studies, which were 34 studies, have showed that gentle wave does improve the biofilm removal, smear layer debris, enhances the sodium hypochlorite penetration into the dentinal tubules, and lowers the apical pressure. However, these laboratory models may not fully replicate the clinical conditions, and the clinical evidence is limited and mostly based on small prospective studies or case series. Nowadays, the gentle wave system is gaining popularity again due to its minimally invasive concept. Therefore, this prospective cohort study by Montero, a researcher at University of Bath from UK, along with Bettina Basarani from Toronto University, conducted this study, which was published at the JOE last year in 2025. They aim to compare the healing outcomes of molars with apical periodontitis after the root canal treatment and retreatment using two disinfection protocols. The first is the gentle wave group with the negative pressure using the Endovac by Kerr. The second group was the ultrasonic activation, which was also combined with the negative pressure. The primary outcome measured was periapical healing, assessed radiographically using the PIA index by Orstavik in 1986. Divided to strict criteria. If the scores were less than 2, it is considered healed. And for the loose criteria, any reduction in the PIA score compared with the baseline would be considered healing. They included 230 maxillary and mandibular molars with apical periodontitis. For teeth required initial treatments and retreatments. All were treated by one endodontist using standardized protocol. 3 minutes sodium hypochlorite 6% and 8% EDTA, rinsing with saline in between, and a final rinse of saline. For the results, the mean follow-up period was around 15 months. The recall rate was 77% and they ended up analyzing 170 teeth. For the healing outcomes, based on the strict criteria, 70% of the cases showed complete healing in the gentle wave group and 72% showed complete healing in the ultrasonic with the negative pressure group. For the loose criteria, gentle wave showed slightly higher percentage of 83% and the ultrasonic activation with the negative pressure showed 87% success. There was no significant differences observed between the two disinfection groups. This study concludes that both gentle wave and the ultrasonic activation with the negative pressure demonstrate similar effectiveness in promoting the healing of apical periodontitis. And finally, this study has some strengths and weaknesses that are worth mentioning, although it's clinically valuable because it does evaluate the real patient outcome rather than the laboratory data. And it includes a relatively large sample size of molars with apical periodontitis. They standardized the protocol, which further strengthen its validity. However, they lack randomization and the control design. One major limitation of the study, in my opinion, is that they included teeth requiring both primary root canal treatment and retreatment, and these conditions are known to present different bacterial profiles and has varying success rates according to the literature, and ideally they could have controlled for this variable by limiting the sample to one treatment category instead of both. And in my opinion, the results suggest that expensive technologies like gentle wave do not significantly outperform the well-established irrigation techniques like the ultrasonic activation with the negative pressure, which raises an important concern about the cost effectiveness in our routine practice. And from a clinical perspective, the study supports the idea that proper irrigation activation, regardless of the system used, can achieve comparable healing outcomes, meaning that it's not necessarily for us to have an advanced high cost system to achieve successful endodontic results. Thank you so much for listening. Hope you have a wonderful day. Bye.